Before we get started on today's episode, I wanted to share a message from one of the sponsors of the Success NP podcast. Nurse practitioners, are you sick and tired of charting at home? I mean, really, who is it? Here's your prescription. The Nurse Practitioner Charting School with Erica D., the NP charting coach, specializes in helping overwhelmed NPs implement charting and time management tips to create a better work-life balance so you can stop charting at home. Make sure to get her comprehensive list of smart phrases that you can copy and paste right into your EHR and immediately save time charting. Check out www.npchartingschool.com for a free preview. Now let's get into today's episode. Today, we're diving into a topic that's critical for nurse practitioner students: how to leave a positive and lasting impression at your clinical site. I'm Sandra, your host, and today, whether you're at the start of your rotation or nearing the end, making an impact can set you apart as a professional and can land you a job when you've passed your NP boards. We're going to be talking about clinical rotations and how they are more than just a graduation requirement. They're an opportunity to build your reputation, expand your professional network, and potentially secure a job offer. Preceptors and staff are not just evaluating your clinical skills, but also your professionalism, your adaptability, and your work ethic. Remember, how you present yourself can influence your future opportunities. And as the saying goes, you never get a second chance to make a first impression. The first tip that I want to share with you is being prepared. Just like a Boy Scout, be prepared. Before each clinical day, review the patient cases, if you can, relevant guidelines, and any clinical skills you may need to practice. Showing up ready and prepared demonstrates initiative and a genuine commitment to learning. Staying organized by keeping a booklet or a digital tool handy for jotting down questions, clinical pearls, feedback, and being on top of your notes and assignments signals that you're serious about your role and you respect the time of your preceptor. I have had students that have come to precept me in the past, and they would research topics after they came to clinic. So they would come into their clinical setting, we would see patients, they would kind of get an idea of what things to write down, to look up, and then that night they would go home and study. I know it's a super grueling time. You're studying, you're probably working as a nurse, and you've got clinicals on top of it all, so it's just really tough. But I'm telling you, that time that you're investing into being prepared for clinicals really is a huge meat and potato part of your work as a nurse practitioner student. I remember when I would go home and I would research things that I saw in the day. I remember also asking my preceptor what I could look up before going into clinicals. I would use the email that I would send to introduce myself as a way to also ask how I could be best prepared so I could hit the ground running and start seeing as much as I could with as much knowledge as I could walk into the door with. The second thing we'll talk about is communication. It is a cornerstone in clinical practice to be able to communicate. And you're meeting somebody for the first time, your preceptor is new to you, so you're learning how to communicate with them. There's 3 tips I want to leave you with for communication. Asking thoughtful questions. And avoid asking questions that you can easily look up. Instead, focusing on seeking insights into clinical reasoning or practical tips that can show your preceptor you're not just what I'll call it pimping your brain. I'm just using you to fill up the space or to fill up the things that I don't know, more so than, hey, listen, I have this baseline knowledge and I'm going to use you to close these gaps, right? That's a better way to ask thoughtful questions. And then provide clear updates. When presenting cases, be concise and be organized. Follow the SOAP note format, subjective, objective, assessment, and plan, to make your presentations efficient and professional. And then the third tip in this section is asking for feedback with your preceptor. Feedback is a gift. I always say that. It's something people do not have to provide for you. But when you get that feedback, take it with grace and just realize that in life, when you're getting feedback, these are opportunities for you to improve upon your techniques and the thing that you're doing. Don't take it personally. Just take it as, this is something that I can learn from. Feedback is a gift is probably my third tip for communicating in clinicals. Sorry to interrupt the conversation, but I wanted to tell you guys about our new head-to-toe booklet. Our comprehensive guide is an 89-page digital reference that serves as a comprehensive clinical tool for adult and geriatric assessments. The medical conditions are covered by systems and include definition, symptoms, diagnostic criteria, treatment plan, and mnemonics for easy memorization. Whether you're in clinical practice or studying at home, this guide will keep you prepared and confident through your adult care rotation. The head-to-toe guide contains common medical conditions by system: eyes, ENT, neuro, cardiac, respiratory, gastrointestinal, general urinary, endocrine, hematology, skin, and ortho. We also have a section in there to help you with presenting your patient case to your preceptor or an MD, and much, much more. Take a look, check it out in our Stan store, Etsy store. You can sign up for our email list, which will save you 20% off your purchase. Now, let's get back to our episode. For the next section, we're going to be talking about demonstrating initiative. One of the things that we tell our students is we like them to take initiative. What does that look like? And that's volunteering to see more patients, suggesting a differential diagnosis, or drafting treatment plans. Don't hesitate to admit that you don't know something, but show that you're eager to learn. Another tip could be anticipating the needs of your preceptor or the clinic. For example, you could help prepare for the next patient or offer to assist with charting under supervision. These small actions show your preceptor that you are eager to learn, hungry for opportunities, and would make an excellent future employee or addition to the clinic. So definitely keep that in the back of your mind, is how can you take initiative while you're in your clinical setting as a student. For my next tip, it's about building relationships, not just with your preceptor, but realizing that as NPs, we work in a team, and the interactions that you're having also includes the entire clinical team, the nurses, the medical staff, and the administrative staff. A warm and respectful demeanor makes you more memorable and fosters a collaborative environment. Try your best to learn people's names, offer help when appropriate, and show genuine interest in their roles. Building these relationships reflects well on you. It can even lead to the mentorship or job recommendations that could be critical down the line. All right. So one of the things that I always talk about is whenever you get out of the clinical day, you get home, you're exhausted. If you're a mom, you got stuff to do for other people. You're just constantly in the grind. But one of the things that helps with some of the things that I've talked about on the podcast about beginning with the end in mind is to kind of reflect back through your clinical experience from that day. Like, what went well? What could you get better at? And that kind of goes back into incorporating the feedback that you might have gotten from your preceptor. And I really think that it's important to reflect on what you're enjoying about your clinical practice or your clinical setting, what you're not enjoying, maybe some things that you're curious about what you're learning in your clinical setting, because that will really help you down the line to really figure out maybe what it is that you want to do when you are practicing as an NP for your career. Because that's something that I didn't really spend a lot of time doing. I just kind of went through my clinical practices and was just like, oh, okay, good, that's done. Check it off the list. But I really should have been figuring out during that time what I was enjoying and what I didn't like. Because I think sometimes you get so focused in on the work, you're really not checking in with yourself. So that's something that I would recommend, is just reflecting, seeing what you enjoy, maybe thinking about, maybe I like this more so than that. And could I build something like that if I ever were to start my own practice? Or I don't know, just whatever it is that you're noticing about that clinical rotation, be sure to journal and kind of process through what it is that you like or you don't like. And then lastly, end on a high note. And as your rotation comes to an end, you always want to leave a positive last impression. Here are some things that you can do. I would say a well-written note, thank you note. Handwritten is super personal and professional and can really show the impact that the nurse practitioner made in your preceptorship. I always left a small token of appreciation, gift card, something that I thought the nurse practitioner would like. I've always was paying attention during the rotation just to see, is this something that I could actually do for them? Do they like a body wash from Bath and Body Works? Just something small that I think can leave an impression that you were paying attention, that you appreciate them. One of the things too is these positions are typically unpaid. And as a practicing NP, we all sometimes feel like the students slow us down in a way because we would normally just crank through patients and not have to explain our process. But we want to teach, we want to grow the nurse practitioner student that's interested in what we're doing, but it does slow us down. And so just taking a moment to appreciate what they did for you is huge. And then also just let the preceptor know that how their guidance has helped you. I probably wouldn't share too much if it wasn't a positive experience, but I think we'll talk about that in our next topic episode is what happens when you're not getting along with your preceptor and some tools to navigate. But for this episode, we're really going to talk about if you had a positive experience with your preceptor and just focusing in on that. And then, of course, stay connected. If you liked your preceptor, there's LinkedIn, there's all the other different ways that you can stay connected, getting her email for future advice. Networking is key in your career, period, point blank. You need people and you need to be creating relationships. And so every preceptor is a chance to network. So that's it for today. Those are some tips and strategies to make a lasting impression as an NP student at your clinical site. Remember, your attitude, your professionalism, and your willingness to learn can set you apart in ways that go beyond your clinical skills. Thank you for tuning in to this episode of the Success NP podcast. If you found this episode helpful, share it with your fellow NP students. Leave me a review in Apple Podcasts. It helps bring the show more awareness and gets it moved up when people search for nurse practitioner content. Until then, keep striving, keep learning, and keep making a difference.